this education is important. Folks need to brush at night, floss, rinse out with a mouthwash, go to sleep with a happy mouth. Let's shift a little bit into patients who already have disease. In my practice in gastroenterology, we talk about nutrition all the time. One of the first parts of digesting the food is when we place it in our mouth and we start to chew, or medically speaking, masticate. We start to chew the food, and some folks don't have some teeth, some folks don't have all their teeth. They have dentures, they have teeth that have been implanted into the jaw. Let's talk a little bit about the importance of your teeth and what can happen when you don't have enough teeth to chew your food.
Well, if you don't have enough teeth to chew your food, a lot of people, they end up swallowing their food sometimes rather than chewing it properly. And of course, that's your field of expertise, but it can cause all types of gastric problems. The patients do report to us about that. They're saying, "Oh, I'm having pain in my stomach and my bowels and gas buildup and things like that." So if I see, for instance, in health, a person should have, say, 28 to 32 teeth. If they have lost, say, half of their teeth or even less, then they can start to have less chewing efficiency. And of course, that can, besides reducing their quality of life, it can actually cause problems with their health. So another thing I always alert the patients, many patients lose teeth in the posterior regions, meaning in the back, and then they start chewing with their front teeth. And of course, that over a period of time, that can destroy your front teeth, because the front teeth really aren't made to crush food. They're made more for cutting and cosmetics and things like that. So the rule of thumb is the teeth are meant to function as a unit. You're supposed to have a certain number of teeth, and each tooth almost has like a different role. So the more teeth that you lose, the more teeth you're going to lose, because you're transferring the load from, say, 30 teeth onto 15 teeth.
So you're compensating with the other teeth.
Exactly.
Because you're compensating now, those teeth start to get injured.
Exactly.
What can we do if someone is losing their teeth? Is there a step of automatically go to dentures, automatically go to implants? What can you do when someone presents and says, "Hey, I've been losing a couple of teeth"?
Well, the teeth, it really depends on where you're talking. For instance, if it's the wisdom teeth, we don't really worry too much about that.
Wisdom are all the way in the back?
Yeah, the wisdom are the teeth that are all the way in the back. They usually start coming in your late teens. Often the patients need to get those teeth extracted, but in my practice, my view is that if they're not bothering you, we leave them alone.
But if they fall out or if they're taken out, that's okay.
Usually that's the case. Now, but if you've lost some teeth, it's important to try to get those teeth replaced as quickly as possible, because obviously you not only are you transferring the load onto other teeth and causing them to have an increased load, which can cause bone loss. Your teeth, the teeth are encased in your jawbone. And if you lose enough jawbone, right, and you no longer have the support, you can lose those teeth. So it is important to replace teeth that have been lost. Additionally, you can have the teeth shifting within the mouth. If you have a space, the teeth can shift backwards or forwards. And a tooth, let's say you've lost 2 teeth and on the top, and you haven't lost those same teeth on the bottom, you can get a process called extrusion, whereby, because the teeth are no longer in contact with the opposing tooth, they'll continue to grow out of the socket. Those are the types of things that can happen due to tooth loss. Right.
We see in our practice in gastroenterology, unfortunately it happens all too often, is that a lady or a man presents to the ER with a piece of food stuck in the food pipe. And believe it or not, this can happen, and it happens quite frequently, where someone will say, "I was eating a hot dog," or "I was chewing on some steak." They swallowed it, but on the way down it got stuck. And it can mean a bunch of different things. It could mean all things. It could mean a tumor in the esophagus. It could mean an allergic process in the esophagus where it gets rough and food gets stuck. What I find very often, though, especially in the older population, is that this all began with poor dental health. "Oh, my teeth are falling out, I haven't replaced them, so chewing is difficult." and they haven't changed their diet. They're still going after the big steak. They're going after a hot dog, hamburger. And here we are in the middle of the night, it's usually 2 o'clock in the morning, and I have to take a little camera, go down into the food pipe and extract this. And so it's important. So if they come to you and they've lost the teeth, what are the options for replacing it? What are the mechanisms of replacing it? How does it get done?
Well, the most basic mechanism, which I try not to employ, are removable prostheses, such as dentures. I think that any dentist would agree that fixed work by means of fixed permanently cemented bridge work or crowns or implants is the best type of work. That the fixed work brings you the closest to the way God created us, which is to have teeth that you can't take in and take out.
And this is
teeth
fixed, meaning
stationary.
that it's put into the jawbone?
Sometimes it's surgically placed into the jawbone, or sometimes if the roots of your teeth are still strong, we'll use those roots to mount crowns or bridge work, which is fixed and cemented permanently, and that can bring you back very close to to excellent function and form, and both cosmetically and functionally.
And they can still go back to eating what they used to eat, or are there some restrictions when this happens?
Well, that's an excellent question. Usually, after a period of time, after a period of acclimating the dental work, they can go back to eating normally. However, I often caution the patients against what we call parafunctional habits. For instance, we've seen patients who like to chew on ice and who like to chew on bones, as an example. Hopefully, we don't see too much of that, but we have seen that, and those are the types of things you want to stay away from. On that subject, I always tell the patients, if you're going to chew on a rock-hard candy or on ice, it's really it's a risk, and you don't know whether you're going to break the ice or whether you're going to break their tooth, because the compressive strength of teeth and of ice is very similar. So yeah, the restrictions are, you chew normally, but you also exercise some caution.
Right, so the strength to crack the ice can almost be the same as what would take to crack your tooth. And I discuss this with patients all the time as well, that if you start to develop some disease, it may be something you could live with, replace the tooth, replace whatever is missing, but you still may have to make some adjustments in life to carry on. But it's so important what you said, replace the tooth as soon as it falls out so that the other teeth don't get stuck carrying the load, and then you end up with more and more damage. It's sort of like when you pull a tomato out at the supermarket, one starts to fall, you pull the next one, and then the whole shelf is gone.
Exactly. I call it, I refer to it as a domino effect.
Exactly.
The more teeth you lose, the more teeth you're going to lose. And interestingly, I always tell the patients, usually, let's talk about the compressive strength of the muscles of the jaw. The main muscles are called the masseters. They're the jaws that cause your lower jaw to make contact with your upper jaw. So I tell the patient, sometimes I'll have like a bodybuilder in the chair, and I'll tell them, you know what, you probably cannot crush a really hard nut with your fingers, but you can easily crush that nut with your jaws. That shows the amount of compressive strength that is brought to bear. So the teeth do need to be in good health, and the teeth need to be strong, and any dental work that you do also has to be strong towards that end.
So to summarize a little bit of what we've been talking about so far, number one, we need to brush.
Yes.
Flossing. We've been told forever to floss, and some of us just laugh it off, and we leave the dentist with that little sample of floss, and that's the only floss we get till the next time we come. So flossing, again,
It's nice you're confessing that.
I may not be the ideal patient. So brushing and flossing, and then especially I like this 1, 2, 3 in the evening, brush, floss, and mouthwash. So that 1, 2, 3 for 5 minutes, that's all it takes for good dental health. And that can save the patients a whole lot of money down the line, because when we talk about replacing teeth, which is very important, once a tooth comes out, we need to replace it so we don't sort of cause injury to the rest of the teeth. Now, once they're seeing you, they are getting their good dental health, some patients still have some complaints, and even in my office, about bad breath. And I want to touch on this for a moment because some of my patients knew I was doing the show today with a dentist. What is the first step, and what are the first things you tell patients who have a complaint of, hey doc, my breath smells?
Well, I'll take like, I don't even need to for me to come to a recommendation, it's usually pretty quick. I'll look in their mouth and I'll be looking for gross abnormality, like really bad teeth. If I don't see that, I'll ask them, let me ask you a question. Did you drink any water today? Often, for instance, this happened just this past week with one of my best friends. He sat in the chair, and I didn't tell him that he had bad breath. I didn't want to embarrass him, but I told him, let me ask you, Dave, did you drink any water today? He said to me that he did not. I asked my assistant to get him a bottle of water. He drank half the bottle of water, and his halitosis was gone.
Halitosis is what we call bad breath in medicine.
Exactly.
And dry mouth, one of the most common causes.
Dry mouth can be a cause, but what I'm finding more and more in my career is that the halitosis is connected to some type of a gastric situation, which of course
like
is...
Like reflux we see can cause...
Yes.
What we put into our stomachs, our food, can smell. After the food is being digested, it could smell. The bile can have an odor. So I tell patients the same thing. What we eat is very commonly the cause of our bad breath. Some of the compounds, what we call volatile organic compounds, can cause it.
Right.
What else? So we talk about dry mouth, what we eat. Can infections cause it?
Sure, oral infections, especially of the gums, if the gums are unhealthy. If you have something called periodontitis, which is a disease.
It's a scary word,
periodontitis.
Periodontitis. Explain that for us.
Okay, periodontitis is a disease of the gums and of the alveolar bone, which is the bone in which the teeth are encased. And what happens is that the gums end up becoming inflamed, bleeding, they end up becoming loose, and now you have gingivae that are no longer protecting the alveolar bone. Simply what I often tell the patients is that your gums are almost like a rubberized gasket, which are nice and tight. In health, they're nice and tight against the teeth. If they're unhealthy, then they start to become detached from the teeth, and then bacteria in the mouth then can now infiltrate into the bone and cause bone loss. So periodontitis can damage your gums and then cause bone loss, and over a period of time, it can cause the teeth to be lost. At first, they become loose, and then they become lost. So if you have something called a pus pocket or some type of an abscess, that can also cause halitosis.
Right, so dry mouth, obviously what we eat can cause bad breath,
right.
Infections, and this all leads back to proper care. If you're brushing, flossing,
right.
mouthwashing, seeing your dentist every 3 months, you can prevent this from going on. Patients ask me all the time, hey, doc, why do I have bad breath? And I try to draw this picture out for them. And as a gastroenterologist, I also try to rule out reflux disease, which is a huge, huge disease. We see it in so many people in this country, and that can also cause bad breath.
Food, the halitosis issue.
Acid, dry mouth, all these things can lead to dry breath. I think we should leave that for another episode, and we should delve into that quite a bit more about reflux and dental health. Thank you for joining us today on Medcastplus. We are here to help educate you, our viewers, on different health topics. We thank Dr. Rahabi for joining us to discuss the importance of dental health. As you can see, a half hour is really not enough to talk about this, but we hope we gave you some information to help you improve your dental health. Be sure to always speak with your dentist and physician regarding your own health. Our show here today is for informative and educative purposes. For more information or to leave a comment or a suggestion, please contact us at medcastplus.com or 718-510-2103. I'm your host, Dr. Jack Braha. Stay healthy, Brooklyn.